I listened to your debate, the podcast debate you had with the boys from Barbell Medicine, and there was Omar
Mhm.
Isuf there, and Greg Knuckles, and Eric Helms, or Trexler, or one of them, or both. I don't remember exactly, but I remember that
Who can tell those Erics apart?
yeah, or Derek, whatever his name is. But I really loved that whole thing and listened to it or slash watched it at least twice. I wanted to talk about injury management and injuries in training. I know it's a massive topic. Can you kind of briefly summarize where, because I'm aware of both of your stances. Can you briefly summarize kind of where you differ from barbell medicine in your thoughts slash approach to injuries and injury management? I know that was like a 2 hour podcast. Can you condense it into five
Yeah.
minutes?
Oh, you know, it's really difficult to get a very specific handle on what exactly the barbell medicine folks think about injury. Um, their position on injury management, injury prevention is, in some cases, I mean, it's clearly quite nuanced, but I'll use a big brainy word. Um, it's sometimes so nuanced as to appear to me obfuscatory. Ooh, that is like something is being concealed, or something that to myself and perhaps some others in the field seems rather straightforward, they don't like to admit as straightforward. And that's kind of what got us into that debate to begin with. So,
Do you think injury management is straightforward?
yes,
Okay.
yes, yeah, yes, I do. And I think that there are absolutely mysteries to it, but I think they may be of the opinion that's quite a bit more mysterious than I think it is. And they seem to leverage a considerable amount of intellect on the biopsychosocial model of pain, and which I think is an important model, it nonetheless can be taken too far. And I think there is some conflation on their end. If I was to not charitably paint their perspective, there's some conflation on their end of injury and pain. What ended up happening, and you probably remember this from the podcast, we would sort of talk about injury, and the barbell medicine folks would sort of start to talk about pain. And I would try to bring it back to like, well, we're not actually talking about pain, we're talking about injury. And here's a distinction between our two camps. I think injury can be defined completely in the absence of pain. I think it's a completely different topic. And I believe that they think that the two are inexorably linked.
Well, I think
And
one of the things that I
mm,
think, if I'm not mistaken, that they said was, if injury exists, I guess, quote unquote, but there isn't any pain, is it actually an injury? I think
yeah,
that's
that's a very easy. That's I wouldn't even say that's really a debate. So it's not a debate, and I can refute that proposition immediately, and I will right now. If we take away, if we chemically silence your nociceptive nerves from your femur completely, and we break your femur in half, are you injured? Now, you could say because you don't feel any pain, you're not injured. And what does it matter? But I suspect you wouldn't say that because you can no longer ambulate and you can't do most sports. And you may be at a very severe risk of having nicked one of your major arteries and bleed to death within the next 30 seconds. So if someone tells you, hey, listen, I'm going to silence your nerve complex that tells you if your femur is broken or not, so you won't feel any pain, can we still break your femur? I suspect you would say no. And then when Preston said, but it's not an injury, you would say, look, I don't know what it's called. I don't want it, but it really is an injury. Injuries, by most folks that talk about them, and this is an assumed idea in the entire athletic training community, in the entire community of rehabilitation, so on and so forth, injuries are when your body breaks. Can you feel the pain from them is an important question, but it is a secondary question, right? Like if it's similar to, if a tree falls in the woods, does it make a sound?
That's exactly what I was
if no
thinking.
one's there to hear it? Well, there's actually a very easy answer to that question. It absolutely makes a sound. Like, that's not really a mind riddle for anyone over the age of 6. So, because sound is the vibration of air molecules or any kind of molecules, and that absolutely makes a fucking sound, even though there's no one there to hear it. Like, it does. Just nobody hears that sound. It's almost as if when you turn on a music player and you walk away 3 doors down, not to be confused with 3 doors down, the music group. You walk 3 doors down, you can't hear it anymore. Nobody touches the music player. You come back, you can ask, was there music emanating from the music player while I was gone? Of course there was. So if you can't feel a certain structure has degraded in such a way that it meets some criteria of cutoff of macro degradation that we would term injury, even if you can't perceive pain from it, you're still injured. And interestingly enough, that may come to bite you in the ass sooner rather than later. So, for example, if you, for some odd reason, get, let's say, an MRI, let's say there's like a nail that you got pushed into your elbow during a work accident, and they get an MRI of the entire elbow, and one of the doctors that looks at it happens to be a sports med guy. And he was like, okay, well, so the nail didn't hit anything important. You should be fine. We took the nail out. But I noticed that your biceps distal tendon is essentially 10% as connected to the bone as it used to be. So we term that an injury. And you say, well, I can't feel anything and I have full force production. What his next thing would tell you is not, oh, okay, it doesn't matter. He would say, look, like, keep doing what you're doing at work or in lifting weights, and that motherfucker will soon snap completely off your arm. Then you will be hurt. And, now that you're injured but not yet hurt, let's talk about ways in which we can rehab the tendon to make it thicker, because now's the time before you get hurt. So injury and pain, two distinctly different concepts. Pain is an evolutionary mechanism by which you detect the presence of injury. It is imperfect. It is sociologically modifiable, but the two are not synonymous.
Right. And I don't want to misrepresent their stance because they're not here to really
Totally.
state it. And also, I did listen to I listened to actually part of that podcast like 2 days ago, but I haven't listened to the full podcast in several months. So I don't want to. I also, there's sometimes I listen to a podcast and I think things and I'm like, this is what I'm thinking, and then I'm like, did they say that?
Right.
So maybe they
Right.
didn't actually say that. But if they did, I understand your point for sure. And so in your experience, what is kind of like the injury management process, or what would be the process that you do, like for yourself or for a client, or do you not touch that? Like, how does that go?
Once injury has occurred,
Yeah, let's say there's suspicion of injury. There's not actually, like, it hasn't necessarily, well, I guess it all depends on how you define injury, right?
well, we can say once injury has occurred, or I thought you may be asking about preventative practices to reduce the probability of injury, which part of the podcast was actually about.
Yes. So I think maybe
Probably the whole podcast.
yeah. So maybe start with the preventative and then go into
Sure.
the actual if injury has occurred.
Sure. So, injury happens even if you take all the best practices, because part of sport training for any sport is the imposition of high forces and velocities onto your joint and connective tissue structures. It's just a thing. So injuries absolutely do happen. It's like, even if you take all the precautions, being a race car driver, sometimes you get into crashes. Shit happens. The road is slick. You couldn't predict it. Your car crashes. But just like being a race car driver, there are driving practices and car engineering practices you can have to reduce the risk of injury or crashing and make the crashes not as bad. There are absolutely things you can do in the gym, for example, and this applies to all sports, but in the gym specifically, it's probably what we're interested here on this podcast. There are a few things you can do to reduce the risk of injury and or reduce the magnitude of an injury should it occur. One easy one is properly warming up. I mean, that physically warms up the structures. It makes them more pliable. It makes them less likely to snap. Another thing warming up gets you
What would
is
you consider properly warming up?
Oh, gee,
That's
a long discussion. But basically, you start with a very low force production for higher repetitions, and you slowly descend into higher force production with lower repetitions. That's
Okay.
it. And the specifics of that aren't super important. It's just that by the time you get to your working weights, you should feel both nervous system wise potentiated. Your technique should be smooth, and you should literally feel, and the structures you're using should be at a relatively high body temperature so that you're not lifting literally cold, because that will absolutely increase your risk of injury.
So you're telling me I should just jump in the tanning bed for 10 minutes?
So I actually, that will almost certainly reduce your risk of injury versus just showing up and going cold. Yes. The physical heating of the structures is important. But you get both the heating of the structures and the sort of moving around of scar tissue and the betterment of technique. And that's why real warming up, physically moving, is better than just going in tanning bed. But I will say some folks' warm-up routines is to go in the sauna for 5 minutes before they even start them moving. And that absolutely does work to get your body temperature up. So another benefit of warming up attends to a sort of separate injury risk pathway, is making sure that your technique is spot on. You have a certain technique that you execute with a certain lift, let's say the squat. And because you've been doing it for multiple weeks, multiple months, multiple years, your body has strengthened the joint and connective tissue structures to deal specifically with the vectors of forces that are presented in the squat. If your technique goes really far away from what you're typically exposed to, then the vector forces change drastically, potentially, and they essentially, a lot of force can be imposed on structures that don't typically have the resistance built up to handle those forces because they physically haven't been trained from that vector. And we know pretty well that both connective tissues and muscles actually change their ultrastructure to handle forces better from the directions those forces usually come from. There's a time and training effect there. So if you normally squat straight up and down, and then you tilt forward really far and try to save a really heavy squat, your chance of injury goes up much higher than if you had always squatted tilted forward for no goddamn reason. So an excellent point that the Barbell Medicine guys make is that a lot of quote-unquote bad techniques that are really injurious, people think, are actually much less injurious if you practice them often. So if someone's doing a round back deadlift, I personally think they don't, that slightly enhances your risk of spinal injury. But what both of us would agree on is that if you're well practiced in the round back deadlift, you have formed a pretty good resistance in all those structures to injury, and you're probably not as high risk as you would otherwise be if you normally flat back deadlifted and then one day you got off course in your deadlift and had to round back the shit. So wildly atypical techniques with heavy loads or ultra high velocities typically result in injury, so you kind of want to avoid that, which is one big reason why people preach really good technique. And it's a very good idea. Like if you see someone at the gym with really like very different technique, rep to rep, you kind of like, I don't know. You ever seen a guy bent over row and it's like every rep is a different lift? You're like, man, one of those is going to be so far off of what your body's used to that you're going to get hurt. So that's a factor that we absolutely can control in the gym. Another one is to not needlessly impose ultra high forces on really small connective tissue structures. So this is a reason why potentially doing really high level cheat curls is not the greatest idea. You are exposing the biceps tendons, which are notorious for ripping, because they're not very big, to incredibly high forces that they themselves can't generate, right? Another one is if you start to fall forward in your squat and you try to save it, you may be exposing your knee joints to way higher forces in the particular parts in which they're just not very strong. Another one is, there's a reason they say not to do chest flies for sets of 3 or 4, right? If you do literal pec flies with dumbbells for sets of 3 or 4 reps, you're exposing the distal pec tendon, which is very commonly torn anyway, to unreal high forces with no way out. So that's probably something you should restrict. So a little mini rule that comes out of there is if you're going to do high force lifts, they should be with a stable technique and they should be with compound movements that spread the forces over large areas of connective tissue. And that really does reduce the injury risk considerably. Another one is a lot of injuries happen during the highest forces and velocities, which multiply the sort of amount of force the tissue actually takes at peak. And if you want to reduce injury risk substantially in the weight room, short of being an Olympic weightlifter who relies on velocity as a primary tool of the trade, what you want to do is consider some pauses or consider slowing the eccentric and not bouncing out of stuff. Because the bounce on the bottom of a deadlift or bouncing off your pecs at the bottom of a bench create instantaneous or very short duration forces that are way better than the average force you would see just through the concentric portion or eccentric portion of the lift. So bouncing out of the bottom of a bench, if you stop doing it, it almost certainly reduces your injury risk to the pectoralis major considerably, right? And so what we have so far is warm up really well, have a relatively stable technique, make sure that you're not focusing super high forces on really small joint structures, and make sure that you control the load. I would add to that, in addition, to use a fuller range of motion, because it lowers the amount of external load and still allows the internal load to be high enough to get you all the results you want. So with just those, and I think there's probably a few more things that can be said, and in that podcast I do say them, but that to me is probably a pretty good checklist that if you go to the gym to get bigger and stronger, if you were to stick to, it's just looking forward a good way to keep injury risk as low as it can be while still allowing you to experience the high forces required to promote the best strength and hypertrophy adaptations. And anytime someone goes really far away from that, for example, rushing the warm-ups, getting real off track on a lift and still trying to grind it out, using super high loads with unstable isolation lifts, and so on and so forth, bouncing out of the hole, stuff like that. If people do that, you kind of like it if they turn to you and say, hey, what do you think of my lifting? And I would say, look, like if you clean up your lifting a little bit in the following sort of regard, then you can probably reduce your injury risk to some extent. Now, again, injuries sometimes just happen, right? Your best approach may not be good enough and injuries will absolutely occur. And of course, in training, there's, and I don't want to open up too big of a can of worms here, but there are also chronic management approaches that you can use to reduce your training. For example, don't ever multiply the load that you're lifting very much over the course of 1 or 2 training sessions. So for example, if you leg pressed 405 pounds last week, this week probably don't leg press 500 pounds. Maybe try 415. And then next week after that, 430, and so on and so forth. Slow ramping of loads allows for much greater tissue adaptation and doesn't let you leave the thresholds of what is safe. In addition to that, probably just as important is volume ramping. Make sure you're not doing 3 sets of leg press this session and 6 sets next session, because then the session after that, you could have degraded the structure so much from that huge increase in volume that 3rd session gets you hurt after the first rep or first set. So instead of going 3 sets this time, 6 sets next time, you need to go 3, and then go 3, and then go 4, and then go 5, and then go 5, and then go 6. That slow ramp of volume actually fits the training paradigm for most outcomes really well, but also prevents the likelihood, a higher likelihood of injury from exposure to really, really high volumes ramped up too quickly. So those 2 other things I think are important for folks trying to design both acute interventions and long-term interventions that reduce, not eliminate, the chance of traumatic injury in the weight room.
Tremendous. I knew you were going to say all of those things, but I didn't know you were going to go that in depth. But I really, really
well, you got me
it.
on for a reason, right?
Exactly. Although one of my podcasting rules is don't ask questions that I know what your answer to them is going to be. Although that was way more in depth than I thought it would be. So what's that?
I said it's fucked up. That's all I've got is answers you already know.
Well, maybe I've watched or listened to too much of your stuff then, but I don't know.
There you go.
But then once you get an injury, what would be your process for managing that? Once you already have like something happen, assumed that it's an actual injury, I guess.
Totally. No. And I have a lot of stuff to say about that. And there's actually quite an elegant process you follow. And the cool thing is like this process has been so well mapped out by practitioners in the field that it's not so controversial. Maybe it's because they don't care about you as a person, but anytime you interact with staff that are supposed to be managing injuries, physical therapists, sports medicine doctors, they never really seem so freaked out about your injury like you do, being the injured person. Now, of course, it's because it's not them, but also it's because it's not exactly the end of the world. And they know that there's a very straightforward process by which to come back, assuming the severity of the injury isn't prohibitive to coming back at all. So here it is. First off, when you get hurt, how do you know you're hurt? My best answer to that is if you feel some kind of clicking and popping with a tremendous amount of pain, just stop. If you have a little bit of pain, maybe a little bit of clicking and popping, it's nothing to write home about, try to do another repetition and see if the pain gets better or worse or stays the same. If the pain stays the same, you can probably do another rep to see how it feels. If the pain gets better, like, oh, doesn't feel as bad in the second rep, just keep going and it'll probably go away. Again, pain is an imperfect perceptor of injury. So sometimes pain will just come and go, and it's just weird brain and nervous system activity you don't have to worry about, right? So, like, if you get really high smoking pot and you feel like you can't breathe, it's not that you actually can't breathe. Your brain's lying to you, right? So,
Unless
like,
you're
I
unless you're
don't know
so high
anyone
that
who
you're
chokes
face,
to death.
unless you're so high that you're face down in your own vomit. But
100%. Yeah, the Jimi Hendrix approach. Yikes. So basically, if the pain gets worse with the next repetition, stop. Okay? Then you can evaluate and maybe try another set with lighter load. Take some load off, try another set. If it's a real injury, the one that, like a serious injury that demands further intervention, even a lighter load will immediately hurt and it'll feel really, really weird. And you're like, oh, you've been injured before, right? You know how it feels. You're like, oh, something's definitely not right with my pec. Okay. Like, and sometimes you feel a little weird towards the end of a set. You're like, ooh, am I hurt? You try lighter weight and you feel nothing. And you're like, huh. Then you slowly work back up to heavy weight over like 2 or 3 sets, and you're like, I don't feel shit. And you keep going, oh, yeah, fuck it, it was nothing, right? Well, like probably 90% of like incidents of pain in the gym that are localized to a specific part of a muscle are just duds. They're just nothing. Like half the time when I warm up for squats, like my quad will be like, ow. And I'm like, whatever. I just keep going, and then it's fine, right? And especially during warm-ups, like I didn't get hurt with 135 pounds on my back. Like, that's not going to happen, right? So basically, a lot of these are self-solving problems, right? So we've just eliminated a bunch of quote-unquote injuries, not actually injuries, pain events that did not indicate structures were actually damaged or sufficiently damaged for us to care about. Those are fine. We just keep training. How if the pain gets worse with each rep, stop. Try later if the pain is still pretty severe and something feels completely off, because it's not just pain we're talking about. Like if you pull your quad, it's not just that it hurts, it's that it feels like your quad's not working properly. And that is even probably more cause for concern than just the pain itself, because you're like, my quad doesn't really feel like a quad anymore. Something sliding in there that it shouldn't be. Then stop. Over the next several hours or days, see how it progresses. Okay, so that's step number 2. See how it progresses. A lot of times what will happen is it'll hurt that day, you limp around. Sleep through the night, wake up in the morning, get up, and like you went to the bathroom, sat down, took a shit, got up, flushed the shit, brushed your teeth, and you were like, oh yeah, my quad was hurt yesterday. I didn't fucking notice it today. You kind of move it around. It still feels a little bit tender, but nothing much. Yeah, you got injured, but it was super, super tiny, super small. What you can do is the next leg day, just do super light, super high range of motion lifting, really work that area out. The leg day after that, you start to use slightly higher loads. If everything's okay, you ramp up loads. 3 or 4 workouts later, that is, 2 to 3 weeks later, you're back to your usual loads. No big deal. I'd say another huge, of the fraction of injuries that don't just occur sort of in the gym and aren't really injuries, I would say that a big fraction of them auto-resolve within several sessions. It's just like a little bit of a thing, So you just sort of slowly work back in. There may be a situation, some injuries are more severe than that, and you wake up the next day in the morning and your leg is swollen and it hurts more and your mobility is shit. And you're like, oh, fuck, okay? At that point, you can go at your own and implement essentially a rehabilitation protocol that I will shortly describe. But what you can do, and I recommend generally, is try to seek like some form of medically trained person, whether it's urgent care.
You're talking about I should go to talk to the naturopath on Instagram, right?
100% chiropractor, like somebody that really knows the body in an Eastern way.
And they know the secret. If they say that, that's how you know.
They got some vitamins to sell you that'll go right to your quad and heal it up. That's $14.99 plus shipping. We're not operating a charity here.
They have to bill you every week for your life.
100%. You're like a client now. So basically, we have the situation where I would, if you think it's a pretty serious injury, a sort of a beautiful thing in this case is knowledge, or is there a formal term for that in medicine called diagnosis? Okay, if it's a pretty serious injury, in many cases I would like to know what's going on. So luckily, I'm married to a sports medicine doctor, so that's not really a problem for me because I just like nudge my wife in bed. I'm like, hey, honey, my quad, and she's like, shut up, usually, and then she'll look at it and she'll say what kind of grade it probably is. She does some mobility testing, some strength testing, um, and she'll say, yeah, like, this is whatever. And a lot of times, again, another one of those vast majority of times, while the diagnostic stuff is really cool to sort of rule out anything that would require medical intervention, um, most of the time it doesn't. So the diagnosis will be, yeah, like you pulled your quad. And you'll be like, all right, what do you guys have for me at the hospital that'll heal it up? And they're like, nothing. It's just a rehab issue, right? Most things don't require surgery. Now, of course, if you pull something off the bone, if your pec is retracted into your sternum, if the bruising is enormous, then yeah, they probably will have to reattach it. But that is very, very, very unlikely. Most injuries absolutely do not require any sort of medical intervention whatsoever, short of the rehabilitative process. The rehabilitative process is very straightforward. I have a few YouTube presentations. I have an interview on the Clinical Athlete podcast on YouTube if anyone wants to see that, about my sort of injury comeback guide. But it's basically this. First, train everything else that's not the injury as hard or harder than you usually do, because you can still make excellent gains the rest of your body. So if you hurt your left quad, you can train your right quad, you can train your hamstrings, calves, everything else, upper body. You can maybe even train upper body harder because you're not as fatigued from bilateral leg training, which is the most fatiguing part of your training anyway. So first of all, train everything hard, because a lot of people, and you may think like, why am I even saying that? A lot of people, when they get hurt in one part of their body, they just stop training everything. Have you ever seen that before?
Yeah, for sure. I've had clients
And it's
do it,
just like,
and it's like
oh
talk
yeah,
it's
and
like
it's like,
talking them off a ledge to even get them to not do that sometimes.
totally. And it's like, look, when you nick your finger on an envelope, do you give up all hope for life? Like, no, that's insane. So, and the good thing is that psychologically, it's great to be able to train other things that aren't hurt, because it like you still have all that joy from training, still a big part of your life. It still keeps your habits going and your daily schedule, and everything's great. So now we turn to focus on, okay, how do we get this muscle group back to work? Now, again, this example is short of a medical intervention. If a medical intervention, particularly surgical intervention, has to be imposed, this would begin after the surgical intervention and after you do formal physical therapy. So this is kind of your own at-home therapy. Here's what you do. The first thing you want to work on is range of motion expansion, okay? So what you want to do is find out what your pain-free range of motion is, and that could be 0, okay? And what you want to do is wait a little bit, don't fuck with the injury too much, until you have a little bit of a pain-free range of motion, and then start regularly, perhaps every day, moving your quad, for example, or moving your leg through that pain-free range of motion. And that's really good. Okay. And then maybe just a session or two later, after you discover you have a pain-free range of motion, you can start to move the leg a little bit into the pain part of the range of motion. So your sort of basically unweighted quad movement should be into the range of, through most of the range or all of the range of motion that's not painful, and a little bit into the range of motion that's a little bit painful. And you want to kind of set yourself a pain threshold of like, okay, this is like a moderate amount of pain. I'm good with doing exercise that causes that, but no more. That would be my recommendation. Over the next several days or weeks, you continue to move your quad into that pain range of motion, stopping at moderate. What you will almost certainly discover is that range of motion tends to expand, often quite rapidly, until unweighted, essentially there's no pain at any point in the range of motion, and you have some pretty decent flexibility. At that point, what you want to do is start loading the actual movement, whether it be with bands, whether it be with a leg extension machine, or better still in most cases, actually doing like a partial squat into a chair and putting some of your body weight onto that quad, most of it on the other quad. And then you again go through that discovery process of how much force can I apply and how much range of motion can I go through until I'm largely pain-free or entirely pain-free. Several sessions or weeks later, you will be at a point where you're moving through essentially like a body weight full, completely deep squat, and all of your weight is shifted onto both legs relatively evenly, and you don't really have any pain or discomfort. Here is where most people fuck up and assume they're completely healed, go to the gym, load up their usual squat weight, and fuck their shit up all over again one repetition later. You don't want to do that. You want to go to the gym and do lots of full range of motion work with sets of 25 to 30 reps. And you can do the myo rep style where you take really short breaks between the sets. You want a nice burn, nice pump, minimal amount of actual sort of injury specific pain, big range of motion. You can do slow eccentrics. Those are actually really good for rehabilitative purposes. Really deep pauses at the very bottom of the range of motion, stuff like that. And of course, you'll get stronger doing this, so you're elevating your loads. You do this until there's absolutely no pain, no weirdness whatsoever, and you're operating at a really, really high level. At that point, you're going to shift into using weights in the 15 to 20 rep range, and then eventually in the 10 to 15 rep range. And now, like, you're leg pressing in the 10 to 15 rep range, potentially squatting in the 10 to 15. I mean, that's pretty fucking heavy. But because you slowly eased into it through all these other modalities, first doing the stuff at home, going through a range of motion, then loading your limb, then coming into the gym and doing ultra high reps that don't provide forces high enough to hurt you, but provide enough force and metabolic stimulus to grow the tissue and heal the tendons and so on and so forth. And then eventually, once you're at the end of a mesocycle where you're doing hard sets of 10 in the squat and nothing's bothering you at all, then you probably can just return slowly and easily to normal training, which can include much heavier work of sets of 5 to 10 or sets of 3 to 6, because fundamentally healed. And of course, ease into those, start with lighter sets of 5 to 10, but over the course of a month or two, you can start to make them heavier. And usually by then you're so well healed and so muscular because you've been doing all this volume. It's added quite a bit of size to your quads. You may actually end this sort of injury recovery process ideally with bigger quads than you started. And not only bigger quads, but pretty much completely healed quads from the injury perspective. And then you're fucking golden, and you go back to doing really, really good normal training. Mind you, it should be normal training with an extra emphasis on technique, slower eccentrics, and pauses to still, for the next several months, yes, it's normal, but it's normal with an eye on minimizing really dynamic movements, super high relative effort, just good old-fashioned normal training with a bit slower eccentrics and pauses. And then several months later, you'll literally forget you were ever hurt. Like there's nothing perceptively about your quad that reminds you of the injury. And then you're probably good to just do normal shit from that on and just be good about stuff and keep going.
Wow, you took me on a roller coaster there. This is my amused face. It's very similar to my normal face. And
excellent.
There was so much going on there. And it's a great, it's like the path, because a lot of people when they're injured, they don't see a path. That's a very clear path, going from the point of injury to right back to even getting better than you were when you started.
Yeah, I've been injured a lot, and I really am uncomfortable with that point right after the injury where you've accepted psychologically that you are in fact hurt, but you feel like an unmoored ship out in heavy seas. You're like, I have no idea what to do. Like, I was supposed to squat 3 by 10 next Monday, but now what the fuck? This plan allows you to automatically go, oh, I'm injured? No big deal. I already know the protocol. You start executing it. It keeps you focused. And after, well, depending on the severity of the injury, several weeks to several months, you're back to 100% and you're good to go.
Awesome, man. So what you're really saying is you need a part 2 of your debate with Barbell Medicine.
Part 5. Bring it on.
We need a 10-part thing. We need to hire professional moderators. We got to get like Tom Brokaw on here or something.
Oh, man, that's great. He wasn't canceled or some shit? I feel like all those guys were hashtag canceled already. What do I know?
He'll be back. Maybe not.
Exactly. He'll come back.
Probably he'll be back.